Allopurinol is used to treat gout and certain types of kidney stones. It is also used to prevent increased uric acid levels in patients receiving cancer chemotherapy. These patients can have increased uric acid levels due to release of uric acid from the dying cancer cells. Allopurinol works by reducing the amount of uric acid made by the body. Increased uric acid levels can cause gout and kidney problems. Indications: treatment and prevention of gout and hyperuricemia of various origins, including in combination with nephroliphasis, renal failure, uric neuropathy, recurrent mixed calcium oxalate kidney stones in the presence of hyperuricaciuria, increased formation of urates due to enzyme disorders, prevention of acute neuropathy with cytostatic and radiation therapy of tumors and leukemia, as well as with complete therapeutic starvation. How to use: the drug should be taken once a day after meals with plenty of water. If the daily dose exceeds 300 mg or symptoms of gastrointestinal intolerance are observed, then the dose should be divided into several doses. For initial therapy, allopurinol should be used in other dosages, 100 mg one time per day. If this dose is not enough to properly reduce the concentration of uric acid in the blood serum, then the daily dose of the drug can be gradually increased until the desired effect is achieved. Special care should be taken in case of impaired renal function. With an increase in the dose of allopurinol, it is necessary to determine the concentration of uric acid in the blood serum every 1 to 3 weeks. Adults, the recommended dose of the drug is 300 to 600 mg per day for moderate course, 600 to 900 mg per day in several cases. The maximum daily dose is 900 mg. Children, the recommended dose for children from 3 to 10 years old is 5 to 10 mg per kilogram per day. From 10 to 15 years, 10 to 20 mg per kilogram per day. The daily dose of the drug should not exceed 400 mg. Allopurinol is rarely used for pediatric therapy. The exceptions are malignant oncological diseases, especially leukemia, and some enzymatic disorders, for example, Lesch-Nychen syndrome. Since allopurinol and its metabolites are excreted from the body by the kidneys, impaired renal function can lead to a delay in the body of the drug and its metabolites, followed by a prolongation of T1/2 of these compounds from blood plasma. Allopurinol and its derivatives are removed from the body by hemodialysis. If hemodialysis sessions are performed 2 to 3 times a week, it is advisable to determine the need to switch to an alternative therapy regimen, taking 300 to 400 mg of allopurinol immediately after the end of the hemodialysis session. The drug is not taken between hemodialysis sessions. To adjust the dose of the drug, it is necessary to evaluate the concentration of uric acid salts in the blood serum, as well as the concentration of uric acid and urites in the urine at optimal intervals. Contraindications: you should not use allopurinol if you are allergic to it. To make sure allopurinol is safe for you, tell a doctor if you have ever had kidney disease, liver disease, diabetes, congestive heart failure, high blood pressure, if you are receiving chemotherapy. Tell a doctor if you are pregnant or breastfeeding. Don't give this medicine to a child without medical advice. Precautions: allopurinol should be used with caution in case of impaired liver and/or kidney function. In both cases, dose reduction is necessary. Hypothyroidism: in the initial period of the course of therapy with allopurinol, a systematic assessment of liver function indicators is necessary. During the period of treatment with allopurinol, the daily amount of fluid consumed should be at least 2 liters, under the control of diuresis. At the beginning of the course of gout treatment, an exacerbation of the disease may occur. For prophylaxis, NSAIDs or colchicine can be used. Do not drink alcohol while taking allopurinol. Side effects: from the side of the cardiovascular system, in rare cases, arterial hypertension, bradycardia. On the part of the digestive system, possible dyspeptic symptoms, including nausea, vomiting, diarrhea, transient increase in serum transaminases activity, rarely hepatitis, in isolated cases stomatitis, liver dysfunction, transient increase in transaminases and alkaline phosphatase, steatorrhea. From the side of the central nervous system and peripheral nervous system, in isolated cases, weakness, fatigue, headache, dizziness, ataxia, drowsiness, depression, coma, paresis, paresthesia, convulsions, neuropathy, visual disturbances, cataracts, changes in the optic nerve papilla, taste disorder sensations. From the hematopoietic system, in some cases thrombocytopenia, granulocytosis and aplastic anemia, leukopenia, most likely in patients with impaired renal function. From the urinary system, rarely interstitial nephritis, in isolated cases edema, uremia, hematuria. From the endocrine system, in isolated cases infertility, impotence, gynecomastia, diabetes mellitus. From the site of metabolism, in isolated cases hyperlipidemia. Allergic reactions, skin rash, hyperemia, itching, in some cases angioimmunoblastic lymphadenopathy, arthralgia, fever, eosinophilia, fever, Stevens-Johnson syndrome, Lyell syndrome. Dermatological reactions, in insulated cases, furunculosis, alopecia, hair bleaching.